Hello.
Hi, good morning, everyone.
Hi, good morning. All right, well, we will go ahead and get started. It's the top of the hour. I'd like to welcome everybody. Hi, everyone. This is Eliana Saramos-White from AMCHIP, and welcome to our September learning session for the public health arm of the Adolescent and Young Adult Behavioral Health CoIIN, the Collaborative Innovation and Improvement Network. I know that's a mouthful. So we're going to go ahead and get started. Just wanted to let everybody know, because we always get these questions, the slides will be made available. This session is being recorded, and it will be made available for archive viewing. So that way, if there's something that you may not have caught during the live session, or if you have any colleagues that weren't able to make today's call, they will have access to the information. So again, this is our September learning session. And so we'd like to know a little bit, yesterday was the first day of fall, the first official day of autumn. So we'd like to learn a little bit more about who's joining us today. So if you could, in the chat box, let us know your name, the state team that you are representing, and why you love the fall season, even if it's not your favorite season. If there's one small thing that you could find to love about it, we'd love to know what that is. So go ahead and use the chat box. It's a great way for us to do a nice little roll call, a nice creative way to see what your thoughts are about the season. And as you're doing that, I'd like to kind of give an overview of what we're going to be covering today in the next hour. So a few quick reminders and announcements, since this is the first time since the July kickoff summit that we've had a chance to reconvene all of you in the same virtual room, and a few announcements. And then we're going to get into the thick of the content and focus really on state sharing, and particularly around some of the change ideas that you may have been contemplating, you may have been working through, or you might be considering as you go through this quality improvement project. Many of you may know, we talked about some of those driver diagrams, some of those key items that contribute to access and quality of mental health services for adolescents and young adults. And it's really now thinking about how do we operationalize those ideas or those strategies to really affect those drivers. So we'd like to learn a little bit more about what you're considering. And we want to also acknowledge that we are trying to make these sessions a lot more interactive, a lot more cross-state sharing, because it's great to hear what others are doing, see if there's a similar challenge with some of your other states, and see if there's also some possibilities for kind of some solutions regarding those challenges around those drivers. And then we're going to discuss very quickly those PDSA cycles that are really core and at the heart of these improvement projects. And then we're going to have a brief orientation to LifeQI, which is the software that some of you will be using to document and to store the data that's necessary to record the progress, the improvement, the experience of this collaborative. And then we'll quickly wrap up with some Q&A, and then we'll let you know what's in store for our November learning session. So we hope that agenda sounds, and it might seem a little packed, but we hope that it will serve a good purpose today. And I see some really great items coming into the chat box. I see some Halloween, some sweater love, pumpkins, whether it's pumpkin flavor or physically, the vegetable itself, the weather, the fall sports, yeah, they're in full swing, and also holidays. So wonderful, thank you for sharing. So I just wanted to offer a few quick reminders that this CoIIN is part of a larger Adolescent and Young Adult Health National Resource Center that's funded by the Maternal and Child Health Bureau. But when you have questions about this particular CoIIN, we wanted to share 4 contacts. So you have our contact information from both AMCHIP and NIPIN. AMCHIP, as you may know, is kind of the leading force in the public health arm, and our colleagues at NIPIN, the National Improvement Partnership Network, are really the forces behind the clinical quality improvement project. So getting into the nitty gritty around the patient experience, the workflows, the depression screenings, and so forth. And so we just wanted to share that information. So if you have questions, feel free to reach out to any 4 of us listed here, myself, Anna, Rachel, and Susan. There's no wrong door option in this case, and we're happy to answer your specific questions related to the collaborative. And again, the global aim, the thing that we're all driving towards is this 80%. That's our magic number. An 80% screening rate for youth that are ages 12 to 25 for a major depressive episode. Again, using an age-appropriate standardized tool, and you're documenting follow-up if that screen is positive. So again, that's our global aim, but the way that we arrive at it through the public health arm and the clinical arm may look a little different, but ultimately we want to make sure that more youth are not only getting screened, but they're also referred to an appropriate treatment source if necessary. And many of you actually asked us, is this the same as the clinical arm webinars, or the webinars that are going to be starting for practices? No, it's actually for the state public health teams, but we're really glad that you're paying attention and that you're eager to focus in on those clinical webinars that will be starting next month. We moved up for this cohort, we moved the start of the clinical QI project up a few months because by the request of many of you, since you'll be working with, some of you will be working with schools, or you just wanted to hit the ground running. And so we wanted to move it up a little bit to accommodate that schedule that you are requesting. And we're glad that you are, we want to make sure that those webinars are an opportunity to learn about what's happening at the local level that would maybe inform some of your strategies at the state or systems level as well. So stay tuned. There's going to be more information coming out regarding those webinars, but they are starting next month. Also, we wanted to share that pretty soon we will be sharing the website that will be hosting and housing all of the information related to this coin. It will be housed on the website that's provided by our friends at Nippon, but it will include not only the archives of the clinical webinars that will be taking place starting next month, but also learning sessions like these. So take a look for that, more information to come out about that website once it is fully up and operational. And again, it'll be your one-stop shop to find, archived learning sessions, materials that we may have shared, templates, and also other updates related to the project. And with that, I'll go ahead and turn it over to my colleague, Anna, and we'll start learning a little bit more about what each of you are doing.
All right, yes, thank you, Eliana, and thank you to all of our team leads for sharing a picture that was representative of what you are landing on in terms of your initial change idea. So without further ado, we'll jump right in. And as a reminder, we're asking for a 3 to 4 minute overview. And if you have questions for your colleagues as they're sharing what they're thinking, please put those in the chat box and then we can facilitate a bit of discussion later on. So first up, I believe we have Kathy in Pennsylvania.
Hi, everyone. Hope you're doing well. As far as Pennsylvania's change idea, in Pennsylvania, as I'm sure it is in other states, different state departments are sanctioned by statute and regulation to perform certain functions and oversee specific services. And while we here at the Bureau of Family Health within the Department of Health are focusing on behavioral health, mental health factors that impact overall health, in our case, the primary function of and responsibility for behavioral health and mental health services across the lifespan actually falls under a sister state agency, the Department of Human Services, and specifically the Office of Mental Health and Substance Abuse Services within that department. So by their acronym, they're known as OMSAS. And the staff at OMSAS has worked diligently for many years on the issues of mental health and behavioral health, but historically, even when overlaps exist regarding efforts and programming, the work of both departments has been fairly siloed with not much active collaboration occurring. So our change goal, at least initially, is to improve and create purposeful interaction between the Department of Human Services, OMSAS, and the Department of Health, Bureau of Family Health, to create meaningful collaboration regarding adolescent health care, which will include behavioral health and mental health. So our aim is to increase interagency communication for identifying intersecting initiatives by meeting quarterly throughout the year. And because this is something new, we actually have no baseline for meeting or information sharing or collaboration. So the quarterly meetings will represent a potential 100% improvement should we be successful with the goal. And our current hope is to establish state partnerships that will assist with education of staff. And since OMSAS is the state expert, quote unquote, regarding behavioral health, mental health, really being able to tap into their knowledge base and understanding of initiatives between the two agencies, especially overlapping ones, that will eventually assist with prevention, access, and policy as noted on the change goals. So we had our first collaborative meeting last week, during which we had introductory engagement with one another. We discussed resources available for adolescent behavioral health, mental health, suicide in particular. We discussed possible places of intersection, for example, what OMSAS is doing, what we are doing, how we might be able to assist one another, and even engage each other's stakeholders. And this resulted in Bureau of Family Health staff gaining access to OMSAS's training site and resources. And because we're doing work directly with LGBTQ youth, OMSAS was very much interested in connecting with and joining in with our efforts, or reaping benefits with our efforts, to have participants in our programs that are reaching out to LGBTQ youth to engage in peer awareness activities and info development that they are currently working on. So OMSAS also shared a recently announced RFA on bullying with OMSAS stakeholders. So already just in one meeting, we're seeing some significant benefits. We need to work at structuring a more formalized change idea and process as we meet with OMSAS next quarter and on an ongoing basis, but we have gotten this change idea up and running. So that's my report.
Thanks so much, Kathy. And yes, it sounds like that first meeting was very fruitful. And when we think about our state capacity assessments that you all filled out at baseline, I heard you hit many of those domains: partnerships, building on existing initiatives, workforce development. So great job. And thank you so much for sharing. There was a question from Eliana in the chat. If you could spell out the acronym for Pennsylvania's partnership, if you could pop that in the chat, that'd be great.
Sure will.
Thank you. All right. Up next, we have California. Is Meryl on the line?
Yep. Yes, I'm here. Sorry, just my video is just getting on. So hi, everyone. I hope you're all doing well. So we chose this photo. We wanted to find young people, but I think this kind of is a nice representation of our public health state team. We are climbing up a mountain and I think enjoying some of the really nice views, if you will, but also kind of see a road ahead that isn't completely smoothed or paved because, yeah, I think kind of like what we heard in the last update, you know, developing new partnerships between government agencies and also non-government agencies can look a little unknown because they're new for us. So we really liked this photo. It is somewhere in Yosemite, so at least it is California based. And I think there's some other folks on my, it looks too green to be California, Tracy wrote. Yes, sadly so. This must be from a few years ago, maybe 10 years ago. But anyways, I'd love to start with some really positive things. We met as a public health state team last month and are meeting again next month, or sorry, at the end of this month. And so I think we're starting to get a little bit of momentum. Like I said, there's a lot of new partners kind of in our state public health team. And so honestly, that first meeting, we spent some time getting to know each other and did some icebreaker kind of activities. And I think, the bulk of our conversation at that first meeting really was about clinic recruitment. Schools were just kind of coming back, and school-based health centers, who is one of our kind of clinic targets, I think are being pulled in a lot of direction, given the surge, again, with COVID and just the back to school in person kind of nature. And so we spent a lot of time, I think, strategizing as a team, about how clinic recruitment was going and how we could support the clinical arm kind of folks on our team. And then we had a lot of meetings kind of offline, I think, to talk more about clinic recruitment. We're really excited. We've got kind of a diverse team so far from, like I said, other state agencies, the Department of Healthcare Services, the California School-Based Health Alliance, the California Primary Care Association. We've been inviting Ileana from AmChip to join our meeting as well, which has been super helpful. Spending some time, I think, explaining to the team like the structure and goal of the CoIIN too was a big part of that first meeting. Really excited though that we developed an application and promotional flyer to invite young people to be a part of our public health team as mental well-being ambassadors, and we got over 15 applications and got to interview all of the applicants, and 4 youth ambassadors are now a part of our team, and I've been meeting with them a little bit separately to kind of have them get to know each other, and then they're going to be joining our big kind of state public health team at the end of this month. So that's been really exciting. I think kind of broadly in California, we're really excited about a really large kind of child and behavioral health initiative in our state that includes $4 billion that goes to various kind of state agencies to strengthen mental health services and connections to schools and workforce development. It just has a ton of stuff in it. And it just passed this past summer. And so we're starting to kind of learn who's kind of leading that and coordinating that initiative, and hopefully bringing them to our next state public health meeting to start to unpack kind of, that initiative and how it might, strengthen what we're doing here in our California state team. As far as like actually looking at like change strategies, we are not quite there yet in our team. We are still kind of focused on making sure we have the appropriate amount of clinics on board. And like I said, kind of just building the infrastructure, and are excited to start to get to those more like creative and fun change ideas from the state public health arm of the CoIIN. So I'll end there and see if anyone, I guess, on California wants to add anything. But yeah, that's my update.
Thanks, Meryl. This is Jennifer Nuovo from United Healthcare, part of the California team. And I think I would echo what Meryl said. Recruitment's been extraordinarily difficult because of the enormous challenges that practices and schools are facing right now. But we really are looking forward to the infusion of energy and funding into various infrastructure build around California to really tackle this systemically. I think we'll be in a much better place, in a few months, including, our own health plan has decided to invest maybe, I don't know, $500,000, something around that, into several collaboratives between clinics and schools around behavioral health. So whether that's funding licensed clinical social worker or a nurse practitioner, or providing training, various ideas are on there, but, separate from the CoIIN, but part of the California discussion about, youth and behavioral health and identifying depression and treatment. Really there's a lot of interest in California in that, in this problem.
Thanks, Jennifer. Thanks, Meryl. Appreciate you both sharing. And kudos, Meryl, to you and the California team for recruiting youth ambassadors. I'm sure they'll play a big role in generating those change ideas and helping inform the direction you all move.
Yeah, I
All right.
think that's a change strategy in itself, honestly.
Thanks.
Great. All right. Up next is Iowa. Melissa, are you on the webinar?
I am.
Hello.
Hi, everyone. Thanks for inviting us to provide an update. Iowa is very similar to California in that we're still trying to focus on our recruitment. We are kind of on the fast track, and I hope Rachel will agree with me that we are on the fast track to recruit some practices. We had a very slow startup. Rachel was very helpful in helping Iowa and our state team identify some practices and meeting with us on a couple of phone calls for those practices that had questions about the project. And again, there was a little bit of hesitancy because of, just things going on and practices and just the amount of time that they have to think about when contributing to a project like this. But I am very, very happy to report that this week we got the report that we had 3 clinical practices sign on, and hopefully more will throughout the next week or so. So we're very glad to see that happening. On the public health side of this project, Iowa is, I feel like I'm the woman in the yellow. I'm there at the top with the great ideas, from the project, and so many learning from so many other states, or the other states in this project, of how important this project could be and impactful it could be. And so trying to solicit those others and talk them into coming on with us and joining us in this project, because it is going to be down the road. Hopefully we'll have much more positive feedback to give you on the importance of the project. So where we are currently, we are interviewing our local maternal and child health contractors at the local level, just really about the projects that we're in and the activities that they're doing. One of the questions that we're focusing on is, what are you doing in your grant application or your project activities to address mental health, adolescent mental health? We've got some partners at the local level that, really have an adolescent health focus, maybe even looking at a community health worker model, trying to decide, what's the best fit and how to make those referrals in their communities. So, if they are seeing those teenagers coming into their agencies, how to make those referrals and who they refer to in their agencies or in their communities. Excuse me. Also, we have a contractor that has ties with a local school district. And so they've done some surveying of the adolescents in the school district about, what they want to discuss with their doctors, what's important to teenagers if they have an opportunity to talk with their physicians or their primary care docs. And so again, we're just still trying to build our team, still trying to be intentional about the partnerships that we develop, but are super excited that we have some clinics that have signed on for the project, and we're ready to get started.
Thanks, Melissa. I hear similar themes so far across our first 3 state teams to share about really trying to build that foundation, building up partnerships, getting an inventory and understanding of what's already happening in your state. So thank you, Melissa. Up next, we have Arizona. Angie, are you available?
I am. Hi there.
Hello.
All right, so
in Arizona, we were or are fortunate that our State Department of Education is participating in the Comprehensive School Mental Health CoIIN. And they have been participating. I think they're in year 3 now of that participation. And so what we realized was that there were a lot of the same state leads in mental health participating in that CoIIN as well as the AYA CoIIN. So one of the things that we initially had talked about during the kickoff meeting was whether or not there was an opportunity to connect both CoINs, and how can we connect them and how can we work together. And so we initially met after that with, we brought both CoIN groups together. We presented the different CoINs and the goals, and it made the case for how really they're pretty similar goals and how could we help one another achieve each other's goals. And so both members from both teams agreed that it made sense to move forward together. And so the nice thing about that is that the SMH CoIN has state leads, right? So they have someone, in addition to the same people, they have someone also from the governor's office, from the Youth, Faith, and Family office who participates in the CoIN, whereas the AYA CoIN has the same state leads. Plus, we have a lot of rural and community-based folks that are participating in our CoIN. So it was a nice leveraging of a variety of experiences because all of these folks are just experts in their fields, and it's really nice to have them on board. It's also an opportunity to leverage funding. They have a little bit of funding, we have a little bit of funding to do something. And then it's an opportunity to see what similar activities could be done to benefit both CoINs. And so we had our first strategic planning meeting, I think it was last week or the week before, where we once again talked about some of the activities that we thought we could work on together. And, just really started brainstorming. I mean, we have two really passionate groups that have come together that each brings their expertise and their and their passion. That's just, it's awesome to see it all kind of transform and the ideas brainstorm and everything else. So we, I think, are on our way. We're starting to talk about activities and what that means and how we move forward with those. We were very fortunate to have the Arizona chapter of the Academy of Pediatrics join us on the clinic side. And they also participate on these CoIN meetings that we have together, but they joined us on the clinic side, and they've just been rocking. They've so far, I think the last report was that they had 29 clinics already secured and signed up who were going to participate in that CoIN piece. And so we hope from our prevention side to be able to do activities that will support, what they're doing and make that a successful piece of it.
Thanks, Angie, and continuing along with the theme of aligning and synergizing efforts. This is great. Really appreciate the visual too that you shared with us.
Thank you.
All right, and last but not least, we have Ohio, and that means Sarah is up.
Hi, everybody. Can you hear me?
Yes.
I'm on my phone too, so I'm always confused. So hi, everybody. Thanks for having us again. I'm Sarah Haig, the Adult Health Coordinator for Ohio. I think I'll echo a lot of what other teams have said. In Ohio, we really have been working on building our team. Very proud of the team that we have pulled together so far. We have a lot of folks from other state agencies in addition to multiple offices within the Ohio Department of Health. We have a couple of folks from the Department of Education, our Office of Mental Health and Addiction Services. We have the Ohio chapter of the AAP, our Ohio Association of Community Health Centers. And of course, our recruiting partner is Nationwide Children's Hospital. So Like other states have mentioned, we're focusing on school-based health centers as part of our recruitment effort for the clinical arm. So Nationwide Children's Hospital is participating as our clinical recruiting partner and then also participating on the statewide team. In Ohio, there are a lot of wonderful initiatives happening across the state when it comes to youth and young adult behavioral health work. We have an Ohio State suicide plan that was released, I want to say a year and a half ago-ish. And part of that is also a youth suicide state plan, which was just finalized and is being approved right now, so has not quite been released. So again, there are multiple efforts happening across the state in this work. And so really what our partners have been doing so far in our meetings is really trying to figure out where we can fit in. So what can we do as far as aligning and coordinating this work to really support, uplift, and supplement the work that's happening across the state. So if this was a week ago, I would probably be looking like that girl from the Pennsylvania picture, which just made me laugh because it has been, kind of a challenge to really figure out where can this work fit in to all the stuff that is happening across the state. So that's really what we're focused on right now, is really getting to know all the partners that we have and trying to kind of map out what all is happening across the state and then where we can supplement that through this work. So I'm not sure if anybody else from our team has anything to add, but that's what I have so far.
Thanks, Sarah, and thank you everybody so much for sharing. And hopefully the sharing across teams was helpful for you all to see that you all really are kind of in the same space of trying to build, figure out, where you all fit in terms of other initiatives across the state, reaching out to partners strategically, even continuing to work on clinical recruitment and identifying those clinics that will be a part of the clinical arm. So thank you so much for coming and sharing your process, and that you're in the building stages and laying a really strong foundation that you can build on, so that you're clear on what your role is in this, larger mental health space in terms of adolescents and young adults. So if you have any questions for your colleagues, feel free to pop those in the chat.